Hello, I'm Dr. John Six, Chief Medical Officer and Vice President of Medical Affairs of the Washington Health System. We're here today with the CDC update on the third vaccination dose for those that are eligible. The CDC does recommend that people who are moderate to severely immunocompromised receive an additional dose of a messenger RNA COVID vaccine, that being either the Pfizer or the Moderna vaccine, at least 28 days after completion of the initial vaccine series. Some studies suggest that people with moderate to severely compromised immune systems don't mount the same level of immunity as those that are non-immunocompromised. Therefore, there may be some benefit to an additional dose of vaccine to make sure that they have protection against COVID-19 when the initial response to the immune system is likely to be insufficient. The additional vaccine should be considered for individuals that fall into one or more of these categories: active treatment for solid tumors and hematological or blood malignancies, receipt of solid organ transplant and taking immunosuppressives or those medications that suppress your immune system, receipt of certain stem cell transplants specifically within 2 years of transplant and on immunosuppressive therapy, moderate or severe primary immunodeficiency, meaning that the immune system does not work or function properly, advanced or untreated HIV, and active treatment with high-dose corticosteroids, generally considered 20 or more milligrams of prednisone or equivalent per day, and also those that are on alkylating agents, antimetabolites, transplant-related agents such as severely immunosuppressed individuals, tumor necrosis factor blockers, and other biological agents that are immunosuppressive and or immunomodulatory. The final group is those that have moderate to severely immunocompromised systems that are determined by their healthcare provider. The additional dose should be the same vaccine product as the 2-dose series that you had received, meaning either the Pfizer or the Moderna. If the messenger RNA vaccine product for the first 2 doses is not available for the third, then another product from a messenger RNA COVID vaccine product may be administered. A person should not receive more than 3 COVID vaccines. If you feel that you fall into one of these categories, please contact your primary care provider. If your health provider is not a site that administers the vaccine, you will need to self-attest and receive the additional dose where a vaccine is being offered. Until more data are available, the additional dose should be administered at least 28 days after completion of the primary series. If you have received the Johnson & Johnson or Janssen vaccine, there is no data at this time to support an additional dose of vaccine. The FDA and the CDC are working to provide additional guidance on this issue. Serological testing or antibody testing to assess the immune response to vaccination and to help guide the additional dose has not been established and is not recommended at this time. If you have any additional questions or concerns, please contact Washington Health System at 724-579-1100. Thank you.